Good evening, everyone. Thank you for joining us. My name is Hayanache, and the Palestinian Return Centre is honored to host tonight's event, Gaza's Health Catastrophe: A Surgeon's Testimony. PRC is a UK-based organization dedicated to the rights of Palestinian refugees and the wider Palestinian people, with a special focus on the right of return and international accountability. We work at the grassroots, policy, and international advocacy levels, including at the UN, to ensure that Palestinian voices and experiences are not erased. Tonight's conversation is urgent. We're not here to discuss a generic humanitarian crisis. We are here to confront the reality of engineered starvation. What's happening in Gaza is not the result of chaos or mismanagement, it is deliberate. Food has been used as a weapon. Hospitals have been turned into targets. Medical staff, children, and patients are being starved by design. And this is not a consequence of war, it is a strategy of genocide. We are joined tonight by someone who has seen this reality firsthand. Dr. Nick Maynard, a British surgeon, recently returned from Gaza, where he worked in some of the most devastated areas under impossible conditions. His testimony tonight will take us beyond numbers and headlines into operating rooms without electricity, hospital wards without medicines, and communities facing annihilation in silence. Dr. Maynard, thank you for being with us today. Please go ahead.
Well, thank you so much for inviting me, and I'm delighted to have a chat to everyone tonight. I'm deliberately going to keep it very informal, so I'm going to give a brief outline, maybe for 15 minutes, but I'm really keen we have an interactive discussion after that, and I'm happy to take as many questions as you like and expand on the themes I've mentioned or bring up new subjects. I'm a humanitarian, I'm not a politician, and I talk about the humanitarian aspects of what's going on in Gaza. And it's pretty brutal, as you will know, and I will share some pretty awful experiences and facts. And although I say I'm not a politician, you can't take the politics out of it. So of course it's inextricably linked to the politics, what's going on, but my focus is very much on the humanitarian side. So just to be a bit about me, I've been going to Gaza. I'm a surgeon in Oxford. I'm an upper gastrointestinal cancer surgeon in Oxford, but I've been going to Gaza since about 2010 for 15 years, and we've had a very strong tradition in Oxford of having strong links with Gaza and the West Bank, and I've been leading a team of doctors from Oxford for 15 years to teach out there. We go out every year to teach medical students at the Islamic University of Gaza and Al-Azhar University, and we do that every year. And we indeed had a trip booked for November 2023 and had to cancel it for obvious reasons. I've also been working with Medical Aid for Palestinians in recent years, helping develop cancer services in Gaza, particularly upper gastrointestinal cancer services. And I've been going out regularly to teach and help them develop gastric cancer services and surgical services. So, and it's been a very long and very productive and enjoyable history of going out to Gaza. And so when the awful events of October the 7th happened, I was desperate to get out there as soon as I could. And I've had now 3 trips to Gaza since October the 7th. I went out in December, just at Christmas, December 23. I led the very first emergency medical team that went into Gaza, and I stayed there for 2 weeks. I then went back a few months later for another trip, and both of those trips were at Al-Aqsa Hospital in Deir al-Balah. And then I've just returned from a 4-week mission in Nasser Hospital in Khan Yunis. And I guess it's fair to say that each time I go, I think I'm going to be prepared for what I'm going to see, because I know Gaza so well, and since October the 7th, 2023, I've been in contact most days with Gazan friends and colleagues that I've worked with over the years, surgeons, other doctors, nurses, non-medical friends. So I really thought I'd be prepared each time, and each time I've been woefully unprepared. And indeed, I think it's absolutely impossible to prepare yourself adequately for what you're going to see. And this trip was I didn't think previous trips could be any worse, but this most recent trip was just awful. And I saw things which I'll just talk to you about, which I really never thought I would see in any healthcare setting. I mean, you'll know the facts and figures. The official statistics are that 60,000, there have been 60,000 trauma-related deaths in Gaza, but everyone who's been there and everyone who's thought about Gaza will recognize that number as a gross underestimate, because there are many thousands of people who are still buried under the rubble and their bodies have not been retrieved or discovered, including friends of mine. So the numbers of trauma-related deaths are significantly higher than that, and probably in the region of 80 to 90,000. And of course, that doesn't take into account the excess deaths, the deaths due to cancer or other non-communicable diseases, or indeed communicable diseases. And you'll be familiar, I'm sure, with the work done by the Lancet, which has estimated that there are probably about, in total, 220,000 people who've been killed, essentially, as a result of this military assault. And that's 10% of the population. So it's a vast number. And those figures really do tally with my experiences in terms of the deaths I saw and the experiences of all other healthcare workers who've been there. And we've all seen and witnessed a huge amount of deaths there. I'm going to talk mainly tonight about the destruction of the healthcare system. I'm going to talk about specifically the targeting of healthcare workers and hospitals and the torturing, the killing of them. And then I'll talk a bit about the huge problem of malnutrition, and talk and use that to really center my main experiences in the last few weeks, because they really illustrate some of the really terrible things going on in Gaza. All the hospitals have been attacked. I mean, there's been a systematic, targeted destruction of the whole healthcare system in Gaza, and it's very clearly a targeted, deliberate dismantling of the whole healthcare system. It's not, as the Israeli propaganda says, bombing hospitals because they're being used as command centers by Hamas. They have never presented any credible evidence to support those statements, and indeed the evidence, the testimony of hundreds of foreign healthcare workers who've been in Gaza have all said that they've seen no evidence of that at all. And the destruction of the hospitals has been a very deliberate destruction of the whole healthcare system. So they don't just bomb the hospitals, they go into the hospitals. And what they did in Shifa Hospital, they went in and destroyed every single laboratory, systematically dismantled laboratories. They systematically destroyed every dialysis machine, all the scanners, the ultrasound scanners, they cut off the cables, the CT scanners, the MRI scanners, they destroyed them. The water tanks, the gas supplies, the sewage facilities, they destroyed all of it to make those hospitals unusable. They've done that to many hospitals. I worked at Nasser Hospital, which of course was partly destroyed last year. It's quite remarkable that the resilience and the resourcefulness of the Gazans have enabled them to make it into a partly functioning hospital again. And they're beginning to do that with Shifa now, although Shifa is really very, very embryonic in its rebuilding. But they've also targeted healthcare workers. They've killed over 1,500 healthcare workers. Again, and all of us who go out to Gaza know these people, know some of these people who've been killed. They've abducted and illegally detained nearly 500 healthcare workers. And again, some of those have been detained for 6 months or longer. Many of them have been tortured. Many of them have been killed through torturing in Israeli prisons. And to name but a few, there have been awful testimonies which have been retrieved describing how they were tortured to death. And I've taken direct testimonies from some of them when I've been out there, and they've been submitted to the international courts, and they are sickening to listen to, how they were beaten every day, stripped naked, blindfolded, handcuffed, electrocuted through their genitals, had dogs set on them. Adnan the iconic, well-known orthopedic surgeon in Gaza, who I spent time with in May 2023 when I was there, was tortured to death, and he was raped to death, with very powerful and detailed testimonies from fellow detainees about how he was systematically raped to death for 2 weeks. So appalling war crimes being carried out every single day. And the narrative being presented by the Israeli propaganda that they are targeting Hamas militants, that they protect civilians, that they only, I think they claim they're the most moral army in the world. Well, let me tell you about the statistics about the children. Over 20,000 children have been killed. The average numbers of children being killed per day in Gaza, the median number is about 30. There have been more children killed in Gaza in the last 22 months than in all the conflicts in the world over the last 5 years. 30 children killed on average every single day in Gaza. The equivalent number for the Ukraine war is 0.7. For Iraq, 0.6. For Syria, 3. For Gaza, over 30. So and we have all the healthcare workers I have spoken to, have been out there with, have witnessed the most appalling numbers of children being killed. We've seen children who've come in shot in the head, multiple traumatic amputations, and terrible injuries. And indeed, 70% of the people who've been killed have been women and children. And that tallies very much with my operative experience in the first 2 trips, where we operated predominantly on women and children, and much fewer males. So we've seen the most appalling things, and the narrative from all the trips really have been constant mass casualties every day, sometimes several times a day, and that was particularly bad recently at Nasser Hospital. Terrible explosive injuries, the results of these awful bombs called fragmentation bombs, which are bombs which have thousands of minute little metal pieces in them, which tear through the human body, causing the most appalling destruction. So those within 50 meters get killed straight away, but people further away end up having terrible shrapnel damage to their chest, to their abdomen, to their limbs, and the surgery for them is clearly very challenging. And the hospitals, Al-Aqsa Hospital that I worked in twice last year is a very small hospital. It's not a trauma center. Nasser was bigger and more organized, but we had to work in the most terribly challenging circumstances with, on my first couple of trips, sometimes there weren't enough surgical gloves, so you had to clean gloves between operations. For one, we rarely had enough sterile drapes to create a sterile operating field, so we had to use gowns and things like that, and gauze swabs to try and create a sterile operative field. We often didn't have enough blood products. The anaesthetists were giving usually much lower doses a normal anaesthetic because they were having to ration the anaesthetic. We often had no painkillers, so we were seeing small children with devastating injuries in the ER, and we had no pain relief to give them. I remember vividly in Al-Aqsa last year, a brother and sister came in, Ali, who was 6, and Aya, his sister, who was 8. Their parents had been killed by the bomb that blew them up. In fact, they were the only 2 remaining members of the family. Ali had a huge hole in his chest, an big open chest wound and terrible burns. And Aya had less severe injuries, but she had a badly displaced fractured femur, and the leg was so displaced that she had lost her pulses in her foot. So that leg had to be straightened immediately in ER before she could have more definitive treatment. And we had no pain relief at all. We'd run out of all painkillers, and her leg had to be straightened by an orthopedic surgeon in the ER without any pain relief at all. And I can literally still hear her screams as that happened. And treating these children with no pain relief was, as you can imagine, very, very distressing. So awful injuries, awful targeting of healthcare workers, and a group called Healthcare Workers Watch. You can Google them, and they've released a document last year summarizing the targeting of healthcare workers, the killing of healthcare workers, the illegal detention and torturing. And they've gone into some very detailed testimonies. It's a very disturbing read, but I think it's an essential read for people to work out, to hear about what's going on. I'm going to move on to the predominant narrative in my most recent trip there, that of malnutrition. And I'm going to talk a bit about the obscenely named, the bizarrely named Gaza Humanitarian Foundation food distribution points. I saw a lot of malnutrition when we were there last time, and indeed my first ever trip in December 23. In January, when we left, we were beginning to see bad malnutrition, and we called that out and said this is going to get much, much worse. And of course, there has never been a day when there's been enough aid going into Gaza. Bear in mind that prior to October 2023, about 500 trucks went in every single day taking essential aid and food, and those levels have never been reached. In the last few months since the ceasefire, there's been no aid and no food going into Gaza, and they are literally being starved to death. And it's indescribably horrific seeing these people. I saw friends and colleagues whom I'd worked with a year previously who I barely recognized because they've lost so much weight. One friend of mine had lost nearly 40 kilograms in weight. He was a big man to start with, but golly, I hardly recognized him. And they are all starving, and the patients are starving, and there is no nutrition to give patients in hospital, no nutrition to give adults in hospital. There are very limited amounts of nutritional support for children and babies. I spent quite a bit of time on the pediatric unit. Although I'm an adult surgeon, I had a young 11-year-old with a terrible esophageal injury who I operate on. So I was up and down to the pediatric unit a lot, and I saw these small little babies who were literally starving to death. There were 4 premature newborns starved to death when I was there. Their mothers couldn't breastfeed because they were so malnourished. There was no formula feed on some days, no feed to give these babies. Sometimes they were being fed with 10% dextrose, which for non-medics is essentially sugar water and has no nutritional value at all. And the reason there was no formula feed was that nothing was being allowed in. Some American doctors I was with, when they came in, they had heard, because they came in 10 days after us, they'd heard there was a shortage of formula feed. So they all brought formula feed in their luggage to help the children at Nasser Hospital. And every single container of formula feed, every single container was removed at the border by the Israeli border guards. And they were very specifically taking formula feed out. They weren't taking other things out. So there was a deliberate policy to remove all nutritional support that could help children from the luggages. And that's why many children died. We witnessed children dying. I saw children. I remember Zainab, a 7-month-old child who looked like a newborn. And you could see every single bone of her body. And she died 2 weeks after I got there. And in the adults, the malnutrition was terrible. It was they come in malnourished. They're immunosuppressed. They don't heal. Their internal repair, they have a massive blast injury or a massive gunshot injury, and they have damage to the liver, the pancreas, the duodenum, the stomach, the bowel, you name it. And we repair it. And because they're so malnourished, those tissues don't heal. So they then start leaking internally. That causes terrible infections. We have to take them back to theatre, and they spiral because not only are they coming in malnourished, but we have no nutritional support to give them in the hospital. So they rapidly get weaker and weaker, and many of them die. So the mortality rate from the injuries they get is far, far higher than it should be. I'm going to finish in a minute. I want to describe the appalling Gaza Humanitarian Foundation food distribution sites. I didn't go to them because we couldn't leave the hospital because it was too dangerous. But I saw multiple young teenage boys who had been shot at these food distribution sites, which have been described by many as sort of killing zones and areas designed to create chaos, to create rioting, and to create a place for Israeli soldiers effectively to shoot young teenage boys. And I saw many young teenage boys come into the hospital having been shot at these food distribution points, and they all and their families all gave the same story. And indeed, Gaza and healthcare colleagues of mine who went to the food distribution points to get feed for their families again told all the same stories, that the Israeli soldiers and the quadcopter drones were shooting these young teenage boys. And I saw many of them coming in with awful gunshot wounds. And if that's not distressing enough, what we also noticed was a very striking pattern of clustering of particular body part injuries on particular days. So one day they would all be coming in with gunshot wounds to the head and neck. On another day, they'd be coming in with gunshot wounds to the chest, the next day the abdomen, the next day the legs, the next day the arms. And on one day, 3 weeks ago, 4 young teenage boys came in, all of whom had been shot in the testicles, nowhere else, just the testicles. And many of these children die. We had a 12-year-old boy die on our operating table because the injuries were so severe. So the pattern, the clustering was so striking, it was inconceivable that it was due to coincidence. And it seemed to us that this was almost like the Israeli soldiers were playing a game of target practice. So I've had 3 trips out there, 8 weeks in total. I have witnessed, in my view, in my opinion, beyond any doubt, multiple war crimes, and I've witnessed a genocide being carried out by the Israelis against the Gazans. And it is deeply distressing to see. I mean, when we leave Gaza, we have a really complex mixture of emotions: relief to get out, to get home to one's loved ones, but great sadness. You're saying goodbye to friends who may be killed soon. You're saying goodbye to patients who may not survive. And it's desperately upsetting leave. You feel guilty for leaving because your friends can't leave. And you feel the most profound anger as well, that the world is allowing this to happen and our government is allowing this to happen. I'm going to stop there, and I will let's open it up and let's have a discussion, and I'll take any questions.
Thank you so much. I can't imagine how it is to share what you've seen and to still hear the screams of the patients. I'm sure this is beyond description. It's what you've mentioned brings me to a question. Like you've compared some numbers, the amount of children killed in Gaza is on average around 30, and then you compared it to other places like Iraq, like Ukraine. And this brings me to another question. Like you treated patients without anesthesia, without electricity or clean water, and in most this is not a conflict, definitely, this is a genocide, but let's say in most conflicts, this would cause global outrage. Why do you think the world has tolerated this level of cruelty in Gaza? From a humanitarian perspective, I know you mentioned you're not a politician, but why do you think like the world has tolerated all of this, especially for a humanitarian sector?
It's a great question. I clearly don't have any better an answer to that than anyone else. I think the Israeli propaganda is incredibly effective. I think it's much less effective than it used to be, but I think in the first year of this, I won't call it a war, but this military assault, you know, inevitably at the very, very beginning, there was a lot of sympathy for Israel because of what Hamas did. You know, there's a whole debate about what actually happened on that day, but we won't go down there. But the Israeli propaganda is incredibly effective, and most people, I think many people were lazy and didn't bother to try and learn enough about it and just believe a lot of the propaganda they were getting. And that propaganda, let us not forget, was promoted by our media as well in the West and by our governments as well. So I think people believed it. They assumed that the stories of the atrocities were just Hamas propaganda, and they believed a lot of what the Israelis were saying. But that has changed. You know, so much has been posted on social media, so much evidence has come out from a whole variety of healthcare workers like me who have, you know, talked about what they've seen. And certainly I think that the world opinion has absolutely changed now, has realized that what Israel is doing is genocidal, ethnic cleansing, and multiple war crimes. I think the majority of the world understand that now. We can have a debate about why our appalling governments don't officially recognize that. But I think most of the world actually does understand and has realized what is going on now.
And when you were in Gaza, I mean, you did explain how targeted it was to just destroy the healthcare system, that it's not just bombing the hospital, it's literally cutting, it's destroying the laboratories, cutting the cables and everything. And I'm pretty sure that is not just done for hospitals, it's just done everywhere. So what signs did you see that wasn't just a humanitarian crisis, but a deliberate strategy to dismantle life itself in Gaza?
I mean, I think it absolutely was the policy, and what we've witnessed, and I haven't been in Shifa Hospital. I've been trying to go to Shifa Hospital, but I couldn't get to the north. But I've seen multiple photographs taken by very close friends of mine. I've had multiple discussions and conversations with people I've known for many, many years who've been to Shifa and described it. And it's, as I said, I think this is a deliberate policy. No one who has taken time to try and study what's going on, no one believes that narrative that they're just that they're being used as Hamas command centers. There is no evidence to support that. And the limited evidence they've tried to give has been, I mean, not remotely credible. And you know, people like me and others, we've been all over these hospitals. We've been to every single square inch of these hospitals. We've had no restricted access at all. So it's inconceivable to me that they're being used as command centers. I don't know what's going on in tunnels because I haven't been in the tunnels, but you know, that clearly remains uncertain. But to me, the policy is very much that of completely dismantling the whole infrastructure of the healthcare system. And you know, people who are displaced will migrate to a hospital. That's why Shifa at the beginning of the war, at Al-Aqsa when I was there, at Nasser, there are many thousands of people living in the hospital grounds and indeed in the hospitals, because when they're displaced, they congregate around where a hospital is because they know they will need healthcare and they want to be close to it. So deliberately destroying the hospital, just deliberately dismantling the hospital, deliberately disabling all the different functions of the hospital to make it completely unusable, that will then lead to displaced people moving further on to try and get close to a healthcare facility. And it's the same argument with dismantling the whole education system, the whole agricultural system, the fishing industry. They're dismantling the whole infrastructure of living in Gaza with a very clear and deliberate aim, I believe, of persuading them that or wanting them to decide they want to leave. So the Israelis can say, well, the Gazans chose to leave. The door was opened into Egypt and they all left.
Yeah.
Now, the door hasn't been opened, but, and indeed, it was very distressing talking to so many friends this most recent trip, and they do want to leave now. They do want to leave. So the Israeli propaganda is working to a degree. Their policy is working.
I mean, as a Palestinian, I have never seen people who are committed to staying in their own land as much as Palestinians and Gazans in precise. But at this stage, and with everything that you see on daily basis, with the starvation and the unbearable things that we're seeing, I think no one can blame Gazans if they want to leave, because it got to the extent where people just want something to eat and water. It's no longer like safety or homes or a roof above your head. Unfortunately, Gazans already came over that. It's more than this.
They can't provide for their families. They can't provide for their children. They're watching their children starve to death. Exactly. Any human would try and get them out of that.
Exactly. And unfortunately, that does mean that the propaganda and the system that the apartheid state is putting is working, because no human being can bear that. I'll move to a question we got from the audience. It says, how are medical staff coping with shortages of power, clean water, and everything necessary during surgeries?
I often don't know how they coped, but they did cope, and they are. I mean, I've been going to Gaza for many years. I've loved Gaza. I've loved the people of Gaza for many, many years. But my admiration for them has no boundaries at all. I am in complete and utter awe of how they have coped over the last 22 months. They are, I mean, words cannot begin to do it justice. They're inspirational to me. They work relentlessly, day in, day out. They're all starving. A lot of them are ill. They've all lost a lot of weight. They're hungry the whole time. And yet they carry on working in the most challenging circumstances. Sometimes, as you say, without any power. I know surgeons who've operated with mobile phone lights. I've been in Al-Aqsa Hospital when we completely ran out of water, couldn't scrub up, or anything like that. The amount of equipment to do surgery is very, very limited. The instruments are old and not working well. We have very limited sutures. So, I was there for 4 weeks, and I was indescribably tired as a result of that. But that is nothing compared to what they have been going through and how tolerant they have been. So, I mean, they do cope, and they are utterly inspirational in how they do that.
Do they cope with the least that they have? Like when they cannot scrub, for example, because of no water, do they find different ways? Or do they do what they have to do?
Alcohol, so we get alcohol jelly and just clean our hands with that. But, it's not surprising that,
of course,
that the amount of infectious complications we see were just appalling. and exacerbated, of course, by their terrible malnutrition. But they do their best, and the overcrowding on the wards makes it very difficult to really do things in a sterile way.
I'd like us to move a little bit to the international medical community. You've described starvation as a weapon of war. So in your view, is the international medical community complicit in this genocide through its silence? If yes, what responsibility do institutions like NHS or WHO carry?
Yeah, I think they are complicit, and I think they're beginning to change. I think that they have been appallingly silent. And I think if you've been silent in this, then you are complicit in what's been going on, because I think, particularly in medical institutions, they've known for 22 months now about the appalling abuse of targeting and killing of healthcare workers, the war crimes, indeed the connivance and complicity of some Israeli doctors and nurses in the torture in Israeli prisons. That evidence has been shown to them. They know this. They can have no excuse to say they did not know. In January 2024, I personally showed evidence to the government. I showed evidence to the BMA. I met up with senior members and told them what was going on. All the royal colleges, the BMA, the GMC, the hospital trust, they've all been told none of these institutes can claim ignorance. So they are turning a blind eye to it. And I think it is absolutely shocking. Now, we have seen change in the BMA. The BMA now has made changes. Good. And that's welcome. It's very, very late, but it's welcome. More and more medical institutions are now giving a platform for people like me to talk at. And I've been trying for the best part of 2 years to talk at the big medical meetings, and was very, very difficult to get access early on. But I am now beginning, and others are beginning to get platforms. Mm-hmm. So I think it's a very legitimate question over the next few months and years as to why they've been silent for so long. But they have been silent, and they should be ashamed of doing so. Of course, it's not too late to start speaking up, but we will not forget how long they've been silent for, and they all need to be held accountable for that in due course, in my view.
I can only agree. How about the medical professionals, like in the UK? I feel like some medical professionals in the UK and elsewhere, of course, still hesitate to speak out, given the abrupt reactions from governments, whether the UK, whether Germany, whether it's any other, especially European countries. What do you say to colleagues who are silent and claim that, many people claim that they are humanitarian and neutral, they cannot take sides, etc.? Do you have anything to say to them?
Oh golly. I do. I mean, I cannot expect everyone to do what some people are doing, what some of us are doing. Of course, I can't expect people to say, "Well, I've gone out to Gaza. Why the hell do you not go out there?" I wouldn't dream of doing that. I have this profound attachment to Gaza because I've been here for many, many years. I got people I would call family out there. So of course I wouldn't expect people to do that, but I would expect them to listen to the evidence and speak out about it. We've got a lot of doctors in Oxford who join the vigils, join the marches in Oxford. A lot of them have privately spoken to me and said how supportive they are. And how proud they are, and in all honesty, yes, they could speak out, they could be much more vocal, but I think there's a lot of cowardice, I think, because they are very frightened about being called out as being anti-Semitic, which of course all of us here know is utterly ludicrous. But this is another example of successful Israeli propaganda, the weaponizing of anti-Semitism, and the accusations still ongoing that people are anti-Semitic if they speak up for Gaza. So I would love more people to speak up. I think for most of them, I'm afraid, I think is predominantly cowardice. I think there was ignorance 20 months or so ago. I don't think anyone can claim to be ignorant now. But again, I do see the tide is turning. I do see more and more people speaking up and protesting, but it's been very, very slow.
Thank you. We got another intervention from the audience. Ali says, "You're such a hero, doctor. Thank you for sharing these stuff with us. Such horrific things. I'm wondering, what should we do as individuals, especially people who feel helpless?"
Well, thank you, Ali. I think everyone can do something, and I think you're doing something just by sitting in and listening to this webinar. You're learning more about it. You can share what you're hearing tonight. You can share what you hear other people talk about Gaza. You can go marching, you can go protesting, and I do believe that's making a difference. It's very slow, but I do believe it makes a difference. To see almost 1 million people marching through central London is an incredible sight. And when I show videos of that to my Gazan friends, they're in awe of it. So I think those things do count for a lot. I really do. Educate people, tell them what's going on, tell them to go and watch this webinar, tell them to watch those films that have been created about the healthcare, the doctors being targeted. I think we can all protest to our politicians. Now, we will not persuade our politicians, sadly, to stand up for Gaza on moral grounds. I don't think they behave like that, the majority of the politicians, sadly. I think there are clearly some of them who do. I think most of them will only be persuaded to act if it benefits them in some way. But if they're at risk of losing votes, that's what's going to make them to act. So a lot of people going to see your MP saying we're outraged by what you're doing and not supporting Gaza, we won't vote for you, all those sort of things. So putting pressure on MPs in a way does help. So donate money to MAP or other NGOs, volunteer. There's lots you can do, but you're doing a lot. Even just for coming and listening to this, you're doing something.
I can only feel with Ali. I'm a Palestinian who left Palestine only 2 years ago, and I always feel like I wouldn't say helpless, but I would want to do even more and more and more for my country, and specifically for Gaza. And I can only echo what you just said. If there is a trusted platform for donations, then please do donate. If there is any space for education, for raising awareness, for telling more people about it. Some people are still unaware about what's going on in Gaza. Some people still believe that Israel has the right to defend itself, and that what is being done in Gaza is self-defense. I have many international friends who are just unaware. They watch different news outlets, and not every news outlet shares the same message. So I think this is a common responsibility on all of us. We can't all be hero doctors, but we can all spread the word. If I could use the last 10 to 15 minutes, I'd love us to focus about the aftermath of this malnutrition and starvation. I read in Israeli papers that but Israel does allow in some formula, some food, or maybe some other countries are able, like neighboring countries, to get in some aid. Do you believe Gaza's health system and, of course, the people can recover from this, or this is a case of intentional destruction of a people's capacity to survive?
Oh, well, I certainly think it's that. I think if suddenly unlimited aid and food was allowed into Gaza overland, let's not pretend that these airdrops are anything other than gestures. We welcome every little bit of food going in, every aid, but let's not pretend they'll make any material difference. They won't. They are gestures and nothing more than that. The only way you can get adequate food and aid into Gaza is via the roads, trucks. And of course, we know how many trucks can get in there. But even if there was unlimited aid and food going in today, there would still be many more deaths from malnutrition, because so many of them are beyond what could be treated with food alone. They need acute medical care. And of course, the numbers of acute medical beds in Gaza has been drastically reduced because of the destruction of the hospitals. So the amount of feed they're allowing in, the amount of food going in through the Gaza Humanitarian Foundation is negligible. I mean, they've been, the death traps have been described to me in such detail that there's food for about 300 people put into a sealed compound, and they wait till there are several thousand Gazans outside before they open a very narrow gate to get in there. And it's, I mean, you couldn't imagine a system more designed to create chaos and rioting. And of course, a lot of the criminal gangs are there who are trying to steal food, and so it's the amount of that food which has gone to where it's needed is negligible. So, I mean, they're lying when they say they've been allowing this stuff to go, and it's very, very straightforward lies. And we have evidence of Israeli border guards, as I mentioned earlier, taking every container of formula feed away from American doctors' luggage when they cross over. So, people will decide whether they want to believe the Israeli propaganda or whether they want to believe the evidence of people like me or many other healthcare workers who are describing what they see with their own eyes. We've got no hidden agendas. We're humanitarians. We tell it as it is, and we've seen the most extreme examples of profound malnutrition and of a country literally being starved to death. And the rest of the world has allowed it to happen. My government's allowed it to happen.
Say, as you said, unlimited food supply and aid and medication came into Gaza. What is it like for the body that has been starved? What does it need? Would the organs really get benefits from food even if fed again? Do they need to be hospitalized and given food under supervision? And we're speaking about the whole population of Gaza. This is not just 10, 20%.
So if they're mildly malnourished, then absolutely just giving them food will restore all that problem. So when you become malnourished, you lose carbohydrate stores over a day or two. Then you start losing fat, and then once you run out of fat stores, you start mobilizing protein from your muscles, and that's when the body starts becoming damaged. You lose muscle bulk, you become weaker. Your bone marrow stops working properly, so you become anemic, you become immunosuppressed. As you lose more and more protein, your heart muscles start shrinking, your heart will start failing. They're often dehydrated as well, so they'll start getting renal, kidney failure problems. And you get weaker and weaker, much more susceptible to infections. And when you're becoming severely malnourished, giving them food can actually be extremely dangerous. They need acute in-hospital care. Giving them normal food can very easily induce something called refeeding syndrome, where you can develop very abnormal levels of different chemicals in your blood, particularly phosphate. And you have to give them very carefully administered intravenous phosphate, other chemicals, in order to restore the balances, whilst at the same time trying to feed them. So simply feeding them can be extremely dangerous. And that's what I mean when I say just giving, I mean, of course we need unlimited food in straight away, because there'll be hundreds of thousands who are in imminent danger of getting severely malnourished if they're not severely malnourished now. But many of those people need emergency inpatient care.
I think I'm coming to my last question, but then I'll leave the last 5 minutes to you to share what you'd like to end with. It could be a personal question, and feel free not to answer, but I'd like to ask, in Gaza, the body becomes a battlefield, and children's bodies, patients' bodies. How do you carry those images with you now? And how are you able to take the decision to go back again every time?
It's I will answer that. I sometimes find it difficult to put into words. There's something very special about Gaza, and it may be if I'd started going to other low-income countries or other war-torn countries, I'd have felt the same. But it just so happened I went to Gaza, and I think they are a truly unique and special people. I think they are an incredibly kind people. They're incredibly resilient, and it's very personal for me. I've got friends, even family, out there, but I think what is being done to them is so unspeakably wrong. It's so unspeakably evil. It's so unspeakably unjust that knowing I have the opportunity to go and help them honestly gives me no choice but to go and help them. And it's as simple as that. I just have this overpowering need to do this. I've got a wonderful wife who is equally passionate about Gaza, and she's never been to Gaza. She'd love to go to Gaza. I'd love to take her to Gaza. I go with her full support. We cook Enas, as we call her, our Gazan daughter, who she was a medical student I taught in Gaza years ago, 3 years running. She got a scholarship to get out, a Chevening scholarship to do a master's in England. She's stayed here ever since. She's now a fully qualified doctor. She's training to be a dermatologist. She's never been back to Gaza. She could never go back and see her family ever. So I would go and see her family. I'd go and see her family every time I went to Gaza. When she fell in love and got engaged to a fellow Gazan in England, her father asked me to give her away because her parents couldn't come to the wedding. When she became pregnant and had a baby, my wife was her mother. So it's intensely personal for us in our family. We have these incredibly strong ties. I think of her family as my family. And I couldn't possibly see this all go on without doing everything I can to help. But it just so happens I'm in a very privileged position that I can go and do that sort of thing. Not everyone can do that, but everyone can do something, which is what we were talking about earlier. Everyone can do something. And I do believe more and more, certainly in my circle of friends, more and more people are doing things now, even if it's just going on vigils, going on marches. So I'm not sure I answered your question, but I started rambling a bit then.
That's totally fine. You did answer how do you take the decision to go back again? And I was asking how did you cope, or how do you cope with the images? But the answer was
it does have a huge impact on you, and I know from previous trips it's very difficult processing everything when you get back, and I know that it takes weeks to do that, and I know that the next few months it does take an emotional, have an emotional impact on you, but it's terribly important. I mean, you develop a very close bond with people you're out there with, so we all talk and everything like that. But it's very important to me having a very supportive family who are totally behind me in doing this.
Thank you for answering that. We've got the last 5 minutes left. Is there anything specific you would like to share or to tell the audience?
I guess I'll just, I think in the last 22 months, we've seen the absolute worst of humanity. I really do. I think what any killing of innocent civilians, whether it was on October the 7th or whether it's been in the 22 months after then, has been abhorrent, but the onslaught by the Israeli military on the Gazan population has been unimaginably horrific. And I've seen things that I would never have imagined I could have seen. Such depraved murder of Gazan citizens, such depraved war crimes. And it has had a deeply profound effect on my view of global geopolitics, my view of Western governments, my view on humanity. And it's changed me irrevocably. I'm quite certain about that. And I'll never, ever be able to come to terms with how the world has allowed this to happen. But let's not forget, we've also experienced some of the very, very best of humanity. I certainly have, in going to Gaza and seeing some of my heroic colleagues who've been out there. And it's been however distressing it is, it's been the most enormous privilege to be out there working with these deeply, deeply heroic people who, as I said earlier, have been utterly inspiring to me. And that's a good, they've been put through an appalling experience. I mean, that doesn't even do it justice, does it? But we have seen spectacular examples of the greatest humanitarians, and I think that my overriding impression of the wonderful nature of Gazans has no limits now at all.
It was a very quick hour. Thank you so much, Dr. Maynard. Thank you for your honesty, your clarity, and your courage, and your voice, grounded in both professional expertise and lived witness, is critical. And to everyone who joined us tonight, this conversation is part of a broader duty, as we said, we all carry, to listen, to document, and to act. What is happening in Gaza is not just a crisis, it's a crime. And testimony like this must be met with mobilization, not just sympathy. Thank you again, Dr. Maynard, and thank you all for being here. Free Palestine, and good night. See you in the next session. Thank you.